Hi guys, my name is Helfia Henselika Suradey Putri. Now I want to present you about COVID-19 vaccine in Indonesia. So, as in other countries across the world, since the pandemic was first declared in March 2020, the protracted COVID-19 outbreak has had a devastating effect on the Indonesian health sector and economy. The country has made extensive efforts to address challenges. The first, the President of the Republic of Indonesia formed a national team for the acceleration of the development of COVID-19 vaccines. The Presidential Decree Number 18/2020, issued on 3rd September 2020, stipulates the formation of a COVID-19 vaccine development team, which is supervised by the Coordinating Minister of Economic Affairs. Additionally, the Indonesian Ministry of Research and Technology is responsible for reporting to the President on the day-to-day work of the team. The second, the President signed and issued a Presidential Decree on 6 October 2020 on the provision of a vaccine and the implementation of vaccination program to combat the COVID-19 pandemic. It stipulates that the government will arrange for COVID-19 vaccine provision, distribution, and vaccination. The decree assigns a state-owned pharmaceutical company, PT Bio Farma, to procure the vaccine in cooperation with several international institutions. It also assigns the Indonesian Ministry of Health to manage vaccine distribution and the national vaccination program. The third, the Ministry of Health and UNICEF have signed a memorandum of understanding that will enable the procurement of vaccines at affordable prices. The signing was part of Indonesia's commitment to COVAX facility, the Gavi and the WHO Access to COVID-19 Tools Accelerator, which was established to ensure that the procurement and equitable distribution of COVID-19 vaccines to all countries. The government of Indonesia expects to receive 30 million doses of vaccine through a bilateral arrangement with different vaccine manufacturers by the end of 2020 and an additional 50 million doses at the beginning of 2021. As mandated by the presidential decree issued in early October, the GOI intends to begin the vaccination process once a safe vaccine is available. The fourth is the National Immunization Technical Advisory Group, or NITAG, conducted a situation assessment regarding COVID-19 vaccination and has made recommendations for access to priority groups. The MOH, with support from NITAG and development partners, has developed a standard operating procedure and roadmap for COVID-19 vaccination. These tools have been disseminated to all provinces and other necessary preparation, including the vaccine introduction readiness assessment tool. All processes have commenced simultaneously. The fifth, upon a request from NITAG, the MOH, with support from UNICEF and WHO, conducted an online survey in Indonesia to understand the public views, perception, and concerns about COVID-19 vaccination. So, there are several questions about COVID-19 vaccine in Indonesia. The first question is, how quickly can the COVID-19 vaccine stop this pandemic? The impact of the COVID-19 vaccine on this pandemic will be influenced by several factors, such as the effectiveness of the vaccine, how quickly vaccines are approved, manufactured and distributed, and how many people were vaccinated. Most scientists predict that, like other vaccines, the COVID-19 vaccine will not be 100% effective. WHO is continuing its efforts to help ensure that any vaccine approved are of the highest possible effectiveness so that they can have the maximum impact on this pandemic. The second question is, how do we know that the COVID-19 vaccine is safe? There are are many safeguards that help ensure that the COVID-19 vaccine is safe. Like all vaccines, COVID-19 must undergo a rigorous testing process, including large clinical trials involving tens of thousands of people. These clinical trials, which involve people at high risk of COVID-19, are specifically designed to identify any common side effects or other safety concerns. If clinical trials show that the COVID-19 vaccine is safe and effective, a series of independent studies of evidence of efficacy and safety will need to be carried out, including review and regulatory approval in the country where the vaccine is produced before WHO considers pre-qualification for a vaccine product. Part of this process also includes a global advisory committee on vaccine safety review of all evidence of safety. Once a COVID-19 vaccine is started, WHO will support working with vaccine makers, health officials in each country, and other partners to monitor any safety concerns on an ongoing basis. So the third question is, will the COVID-19 vaccine provide long-term protection? It is too early to know whether the COVID-19 vaccines will provide long-term protection. The answer to this question needs further investigation. The good news, however, is that existing data indicate that a large proportion of people who have recovered from COVID-19 have an immune system response that provides at least some protection against reinfection, although we are still studying how strong this protection is and how long this protection lasts. It is also uncertain how many doses of a COVID-19 vaccine will be needed. Most of the COVID-19 vaccine currently being tested use 2 doses. So the fourth question, can people who are vaccinated against COVID-19 still transmit the coronavirus? Marion Pepper, an immunologist at the University of Washington, says it's not just a question for this vaccine but for vaccines in general. After receiving the COVID-19 vaccine, if a person is infected with the coronavirus, it is unlikely that they will cause severe symptoms, maybe even without symptoms. However, in this condition, it can still transmit the coronavirus to other people. But the immune system still retains memory of the virus, and when the virus reappears, cells start to work and begin to prepare a new set of antibodies. And however, the process can take 3 to 5 days. So guys, that's it for my presentation. Thank you so much for your attention. Bye bye.